Now, in this very interesting CT scan of the brain, we can simply pause the video and you can try to find out the problem. Now, when we see there is obvious some problem over here. So this is the right side of the brain. When we zoom in, what we can see that there is definitely this is CT scan of the brain because this dense white structure is all bone. So we must know the dense white structure or hyperdense structure on the CT scan. It is either calcium or blood or bone. So in here we see that this is a part of brain parenchyma, and there is patchy cortical dense white lesion, which has to be obviously blood, because you won't get this calcium here or you won't get any bone here. So what we can see in this, first thing we can simply localize which portion of the brain is involved. Now we see here this is the middle cranial fossa, and this is posterior cranial fossa. This is anterior cranial fossa. This is a complete segregation. We can see that this is a temporal bone, and this is middle cranial fossa, and this is posterior cranial fossa. So in the cranial, this temporal or middle cranial fossa, what we have is temporal lobe of brain. So it's very easy to see that this is temporal lobe of brain, where we can see this bleeding is here. So temporal lobe of brain is affected. This we can very clearly see. This is left temporal lobe of brain, and here it is right, and we can very clearly see a very hyperdense or very much dense white structure which is bleed. And you can see around this dense white or around this bleed is a dense black structure. This is all marked edema. We can see this hypodensity. You can compare this hypodensity here. It is not that much dense black. Compare this dense black structure here. So this is all marked edema which is there. Here also there is marked edema, which is not at all there obviously on this left side. So we have to simply compare this left side to the right side, and you can see that there is marked edema because there is marked hypodensity or radiolucency. You can see the blackishness, which suggests that there is marked edema around this bleed. So this dense white structure, a hyperdensity is all blood, and there is patchy bleeding. One must think the DDs can be hypertension related bleed. Now hypertension related bleed, the most common sites for hypertension related bleeding is PTPC. That is, the most common site is, the first is putamen, that is P, then thalamus, that is T, then pons, and then cerebellum. So this is hypertension related PTPC. So here the thalamus is completely spared, the basal ganglia is completely spared, the cerebellum is completely spared. And a main thing is this has to be a subcortical bleeding, but here it is or cortical bleed. It is almost placed outside the midline. So if it is hypertension bleed, you usually get this bleed in this midline area, in this portion. But in this case, it is or cortical or placed peripherally. So which very highly suggests that this is not at all hypertension related bleed. In hypertension related bleed, there will be a single patchy large bleed usually. This can be like this. But in here, what you will see is a patchy bleed. And there is associated infarct also, because infarct will look hypodense or blackish. So there is infarct, there is bleed, and there is marked edema as well in the CT scan. So whenever there is edema, the brain will try to get shifted to other side because of the marked edema. And what can we document it? Yes, we can definitely document this. Now we see here, these are the two lateral ventricle. This is the lateral ventricle of left side, which is very well seen. This is the posterior horn of lateral ventricle. This is posterior horn of lateral ventricle of left side. But where is on the right side? On right side it is not there because it is all compressed because of this edema. Here also it is almost very compressed. We are not able to see. Same thing here. The left-sided lateral ventricle horn can be very easily visualized, but on the right side, it is not very easily visualized because it is all compressed because of the edema on the right side. The same thing here. You can see the lateral posterior horn of the lateral ventricle on the left side, but on the right side, you are not able to see. That is because of the significant edema, significant swelling, and because of the significant pushing of the right side brain to left side. So in short, there is midline shift, and we can very easily document this midline shift as well because we can draw a line. We can see this is the sagittal line, which actually tells that this is the midline. So you can see that this distance is much lesser compared to this. This distance is much more. So in short, the brain is getting shifted here. So this patient has midline shift, marked edema as well. Uh, so in short, this patient, I'll show you the midline shift here also. Here also it is very well understandable. You can see that this is the midline line that we can see. This is the midline line that we can see. This is much lesser compared to this. This is definitely larger because this brain is getting shifted to this side. Here also the midline is here. This brain, left-sided brain parenchyma is getting compressed, is getting shifted because of this right-sided brain shifting toward the left side. So in case this is a very typical infarct with hemorrhagic transformation with mass edema with shifting of the brain to the left side. This is a very typical example of cortical venous sinus thrombosis. This patient had a right-sided transverse sinus thrombosis. This patient had transverse sinus thrombosis. This patient had right-sided sigmoid sinus thrombosis and also had internal jugular vein sinus thrombosis. So this is a very typical example of CVST. CVST look almost always like this. Any patient who has infarct plus this patchy bleed, especially involving the cortical part, is almost always and always cortical venous sinus thrombosis. The treatment is pretty straightforward. The treatment is low molecular weight heparin, mostly Clexane or enoxaparin, 0.6 subcutaneously BEID, and most of the time patients do better if there is midline shift significantly, if the patient gets comatose, if the patient lose their consciousness. Such patients may need intubation. Such patient may need decompression craniotomy so that till the sinuses get opened, till the ICP gets better, patient can survive, and there should not be any uncal herniation or brainstem herniation and sudden death. So this is a very interesting case of CVSD. Thank you.